Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital. Welcome to Yale Cancer Answers with Dr. Anees Chagpar. Yale Cancer Answers features the latest information on cancer care by welcoming oncologists and specialists who are on the forefront of the battle to fight cancer. This week it's a conversation about integrative medicine with Dr. Gary Soffer. Dr. Soffer is an assistant professor of clinical pediatrics at the Yale School of Medicine, where Dr. Chagpar is a professor of surgical oncology.
So, Gary, maybe you can start off by introducing yourself and telling us a little bit more about what you do.
So I see patients at Smilow for integrative medicine consults, and this usually involves different questions about different things having to do with integrative medicine, obviously. I think it's probably important to discuss what integrative medicine is. I think most people associate it with what's called complementary or alternative medicine. So alternative medicine is really when you forego your conventional therapy, maybe decide not to do chemotherapy, and you go elsewhere and you get alternative treatments against the recommendations of your doctor. Complementary medicine is when you're doing both at the same time. So you may have your oncologist and you may have a acupuncturist in the community, but they're not working together. What makes integrative medicine really, really special is that we're creating a space for patients to really coordinate that care and have these conversations in an open way so that we can really support them and really meet them with their value system. We tend to focus on different things that don't show up in the oncology office. Things that I really believe, and I think most patients really believe, and doctors really believe, allow patients to thrive while they're going through these things. So we may talk about nutrition or sleep or exercise or community, spirituality, and then we try to integrate and bring in things that may just make them feel better. Ultimately, my goal is really just how do I make a patient feel better in the least invasive way possible.
So that sounds all great. And many of the things, and we may dive into this later on in the show, many of the things that you mentioned in terms of sleep and nutrition and exercise and so on are pretty well known. And I think many patients are aware of them. We started the show by saying that you're going to tell us about houseplants. That might not be something that so many people are aware of. So can you talk a little bit about how houseplants can be used for better health during the winter?
Yeah, of course. I mean, like many things, we sort of distill out, right? So while people might not know that houseplants are beneficial, I think most people know that being in nature, being connected to the ground and soil is really important. In integrative medicine, we have a term called grounding, right? Things are grounding. They allow you to be present. And that really does come from this concept that we're out in nature. So how do we distill it, right? Because we don't have access to nature. Many of us live in these urban environments. And so certain researchers have started to look at the benefit of being around houseplants. And it seems like there is some benefit to having houseplants in your home and taking care of them and gardening them.
So why is that? I mean, because some of us, might not have a green thumb and might not thrive in an environment of gardening. So, what's the science behind it? And for those who may not have a green thumb, is being around dead plants just as good as being around live plants?
So, it all really started with this very cool study that I always love to talk about. So they took two different groups of patients who were post-operative. They both had just had some major surgery. And about half of them they put in a room that faced out and looked out on trees and plants. And the other half was looking over a parking lot. The patients who were looking over the trees required less pain medication. Their nurses actually liked them more, and they're out of the hospital even quicker. So even just being exposed to it in some small way can actually have a really meaningful impact on your health. To answer your question about, what are the benefits? So there's lots of benefits. First of all, just being outside, being physically active, all those things are important. But what's really, really cool about plants is they release these things called biogenic volatile organic compounds. And these are chemicals that have actually been shown to decrease inflammation, and they're constantly releasing them at all times. So you don't necessarily need to be outside to be exposed to them, but they probably need to be alive for you to be exposed to them. So I would say, live houseplants over dead houseplants are probably a better thing.
But the study that you mentioned makes it sound like even if you don't have green thumb and you don't have houseplants that can stay alive for more than a few weeks in your home, even having a window where you can look out over a garden or a lawn or a tree might be still beneficial. Is that right?
Absolutely. There was even a study, I think in 2015, where they showed that just being in a green space or just looking at plants for as little as 40 seconds improved mood and focus afterwards. So everything's a spectrum, right? I talk about this a lot with meditation too. You have these 10,000 hour meditators that are considered expert meditators, but you don't need to meditate for 10,000 hours. You can meditate for 5 minutes a day. And the same thing goes for being exposed to nature, being exposed to green, is just a little bit. Just try to get these small moments in your life, your small moments in your day where you're being exposed to these things, and there's likely a small benefit to it.
Yeah. I wonder whether part of those two concepts actually are tied in together. In other words, when you're looking at, nature and trees and greenery, etc., versus a parking lot, you do tend to be more meditative, for lack of a better word, in the sense that you may be more in tune with your feelings and your thoughts. You rarely are thinking about anything when you're looking out into a parking lot. Have people seen whether those two concepts are conflated?
In what way? Can you clarify?
So what I mean is, let's suppose you are in a space where you're looking out over a parking lot and you try to meditate, versus you're looking out over a space that has greenery, but you're not meditating. One would think that actually being around green spaces is more conducive to having, moments of contemplative thought versus looking out over a parking lot. I'm wondering whether the effect that people see when they're just looking at greenery has more to do with the fact that they may be more in tune with their thoughts and their feelings, and taking a moment in a type of meditation versus looking out over a parking lot.
Yeah, so this actually speaks volumes to the challenges of being an integrative medicine practitioner in a conventional medicine model, because it's really difficult to distill all of these aspects into small units like we often do in conventional medicine, right? We find a molecule that might be effective and we put it in a pill and we give it. It's really easy to do that. But there's so many components to wellness and health. To your point, maybe it is easier to meditate in nature. In fact, there's nature meditations that are probably a little bit more accessible and a little bit easier for people to introduce themselves to meditation. But meditation alone also has its benefits. When we're using these traditional practices, they come from traditions. They come from these holistic approaches. And so when we're focusing on these tiny little aspects, it's much, much harder to study.
Yeah, that's a good point. Although we're talking right now about houseplants, given the fact that we are about to begin winter, one of the things that you mentioned earlier kind of struck a chord with me, and that is, kind of being in the soil, right? And being outside. So can you talk a little bit about what it is that, is it that you need to be in the soil, like planting your own garden, that produces these benefits? Or is it simply being around nature? Everything that you said notwithstanding, about teasing out the small differences notwithstanding.
Right. I think about what my grandfather used to say, which was, don't let perfect be the enemy of good. Right? We all try to find spaces that are good for us and spaces that are healing. The one thing we always want to make sure is, this should not be a stressful experience to you. This should be an opportunity, to your point, to be present and to be in the moment. So, if going outside in the winter and being in the freezing cold, but being in nature is stressful for you, like it is for me, then don't do it. Find other opportunities within your house, within your home, to be able to do that. Everything's a balance. What I love so much about integrative medicine is that we have this huge toolbox we get to pull from. There's just so many opportunities and so many options. And we try different things. Certain things work for certain people and other things don't work for other people. Everybody's different. I've never had a patient come to my clinic and leave with the same plan as the patient before them. Because again, everybody's different. Everybody has different needs. Things tick for different people. So whatever works for you, you should pursue that. But as long as you're being intentional and mindful about it, that's going to get you to the point that you're looking for.
Mm-hmm. And so if you don't have a green thumb, you shouldn't stress over the fact that, if you planted a tree, it might die. You may want to think about, doing other things that could equally well help your health. Is that kind of it?
I have a yoga teacher who says, a position should be uncomfortable but not painful. And so if you don't have a green thumb, but you still want to pursue this because it's a journey, you should do it. If it's horrible and giving you headaches and keeping you up at night, you shouldn't. But there's even if you don't have a green thumb, there's space for growth, and there's an opportunity for personal development within that, and you should take advantage of that.
So Gary, when we think about these chemicals that you said plants produce and so on, and I can imagine that some listeners are thinking, boy, that sounds really good. But boy, I just don't ever want houseplants because, I'm just afraid that they're going to die. So one question that I have for you is, has anybody looked at the health benefits of things that are difficult to kill versus things that are easy? So for example, the difference between a fern and a cactus, because some people might be able to plant a cactus in their house, but does that have the same effects?
I don't think anybody's ever looked at it, but I will say this. One of the most difficult things to actually kill are herbs. It's really, really easy to grow herbs in your home. They're accessible. You can find them in lots of supermarkets. You can find them at lots of garden stores. And then you start incorporating them into your diet, and you're getting a whole mix of benefit there, right? Because you're cooking for yourself. You're adding, nutrition to the plants themselves. That's really what we go for in integrative medicine, is sort of that holistic approach.
Fantastic. Well, we are going to take a short break for a medical minute. Please stay tuned to learn more about integrative medicine with my guest, Dr. Gary Soffer.
Funding for Yale Cancer Answers comes from Smilow Cancer Hospital, where spiritual care offers support to patients seeking peace in the midst of their cancer journey, while respecting the unique philosophies, spiritualities, and religions of patients and caregivers. SmilowCancerHospital.org. Over 230,000 Americans will be diagnosed with lung cancer this year, and in Connecticut alone, there will be over 2,700 new cases. More than 85% of lung cancer diagnoses are related to smoking, and quitting, even after decades of use, can significantly reduce your risk of developing lung cancer. Each day, patients with lung cancer are surviving thanks to increased access to advanced therapies and specialized care. New treatment options and surgical techniques are giving lung cancer survivors more hope than they have ever had before. Clinical trials are currently underway at federally designated comprehensive cancer centers, such as the Battle II trial at Yale Cancer Center and Smilow Cancer Hospital, to learn if a drug or combination of drugs based on personal biomarkers can help to control non-small cell lung cancer. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Welcome back to Yale Cancer Answers. This is Dr. Anise Chagpar, and I'm joined tonight by my guest, Dr. Gary Soffer. We're talking about integrative medicine as a whole. And before the break, we were really talking about how houseplants can be used for better health, particularly during the winter. But Gary, maybe you can talk a little bit about how people can improve their health overall. Besides using houseplants and herbs, can you talk a little bit about some of the other options that people have to really improve their health over the holidays?
Sure. So, we talked about integrative medicine having this massive toolbox, and there's just different aspects that we often think about. So some of the big box categories are thinking about your sleep, your physical fitness, your spirituality, which is particularly relevant during the holiday season, your community, which is also really relevant during the holiday season, and then, of course, nature, which we spoke about before. During the winter, I like to also think about this concept of hygge, which is a Danish idea. I think we might have talked about it on the last podcast, but it's this idea of being comfortable, making yourself cozy. My kids love the word cozy. And it's finding that comfortable sweater, brewing that tea, turning off your phone, setting the lights down low, and just creating a space for yourself that's warm and comfortable and allows you to just be present in the moment. And I think it's a really nice thing to set up for yourself during the holiday season, which can be particularly chaotic and sometimes a little bit overwhelming for a lot of people, especially if you're going through cancer, right? You have all these interactions that you're anticipating, that you're dealing with. You have to answer questions 300 times that you probably don't want to keep answering. Taking those moments of solitude and peace and quiet becomes really special and really important.
Yeah. I mean, I can see how that concept of hygge really will play out in the holiday season, where you light some candles and grab a book and sit by the fireplace and have a cup of hot cocoa. Some of the other things might be a little bit more difficult. So when you're thinking about nutrition, for example, before the break, you were talking about herbs, but oftentimes the holiday season, I find, is one of two things. Either it is a tremendous sugar high, or it is the stress of preparing a large holiday meal, both of which I'm not sure are going to do a whole lot of benefit for my health. So can you give our audience some tips on nutrition during the holidays?
So first of all, I think the first step is always to be mindful and be present. So, there's this concept, Ayurveda is traditional Indian medicine, and there's this beautiful concept from Ayurveda about cooking with love. And that while you're cooking, you should always be cooking with intent. And so when you're making that meal and you're stressed out, just take that moment and sit back and be like, who am I cooking for? I'm cooking for those I love, and I'm going to put that into it. And that surprisingly has a profound impact on how we approach these things. In terms of food, again, the same idea is to be present. You should never feel guilty about what you eat, but you should enjoy it. You should be in that moment. In Judaism, we have a concept where you say a blessing before every food that you eat, and you say a blessing afterwards. And while you don't have to say a blessing or something like that, just taking that pause, that brief second to say, I'm going to eat this pie, but I'm going to enjoy it and I'm going to be here. And then I'm not really going to go for a second slice after that. And then there's obviously the more practical approaches, is really trying to fill up your plate with vegetables first before, stack it up, and then go for the stuff that isn't quite as healthy for you, and have a small space available for that on your plate. Right?
Yeah, I think that's such good advice, and not really stressing too much about it, but trying to take things in moderation. I know that some of our previous guests have talked about kind of an 80-20 rule. So 80% trying to be as healthy as you can, but allowing you that 20% of grace, particularly during the holidays. Now, another thing that you had mentioned before the break, which I think is a really good concept and something that might be difficult during the holidays, is physical activity. So, you mentioned that going outside in nature, and you can imagine that actually might be fun during the holidays, getting everybody together in warm coats and going outside and doing a walk in a park or in nature. But for some people, particularly who are going through a cancer journey, getting that physical exercise might not be as easy as it might be for others. Can you talk about ways that people can, get that physical activity?
Sure. I mean, I think when people think about going for walks, they sort of make it a little bit more grandiose than they need to, right? Where they think about going to the park for a walk or walking, a few miles around a lake or something like that. But just walking down your block for 10 minutes, phone off, music off, and just being there while you're walking is actually really, really healthy for you. And there's physical benefits as well as the mental benefits. There's also YouTube videos available. I fell in love with yoga on YouTube. I started doing a 30-minute practice through that. And so there's opportunities like chair yoga and things like that. And even at Smilow, we offer free classes that you can take online that allow you to do things at home and be physically active at home.
Yeah. And I think to your point, it might not be a really long thing. It might not be a really strenuous thing. It might just be, just trying to move even a little bit and getting the benefits out of that. Now, that brings me to the next big category that you kind of talked about before the break, which I think for many people is a little bit intimidating, and that is meditation. So we've heard a lot about meditation, and a lot of people are big proponents of meditation as being present with yourself and talk about the benefits of meditation. But I think for some people, it's actually a little bit scary. Like, we don't know how to meditate. We don't know if we're meditating right. And it feels kind of uncomfortable when we just kind of sit there with our eyes closed. So can you help people who might be thinking about trying meditation, but might be a little bit ambivalent?
Yeah, I think most people get meditation entirely wrong. I think, to your point, they overthink it all the time. And that's the antithesis of what we're trying to accomplish with meditation. The whole idea of meditation is really just paying attention. So being focused on a singular point. And so that singular point can be your breath. It can be the feeling that you get while breathing in and out that you get in your stomach or in your rib cage, or even one of my favorite points to focus is right at the tip of your nose. If you breathe in through your nose, you sort of feel this cold air. And as you breathe out through your nose, you feel this warm air, which is not something that we all notice every day, but is going on all the time. And you just bring your attention to that point of focus, and you expect your mind to start going, right? We're human, like our brains start going, and everybody's got this idea that you're supposed to empty out your brain or something like that. And that's just impossible. But what is possible is the narrative, controlling the narrative that we tell ourselves afterwards, right? So if we have a single thought, where are my keys? That's okay. That's human. That pops in. But then you start having a whole conversation. Well, I lost my keys again. I'm an idiot. I can't stand myself. Why do I always lose my keys? How am I going to get the kids today? That's the narrative that we tell ourselves afterwards. And that's really where we have the control. And that's where we work in meditation. It is overwhelming. There's over 10,000 different types of meditation out there. And what I suggest is you just pick the one that resonates with you the most, and don't do it for more than 10 minutes a day until you get really good at it. And by really good, nobody's really good at meditation. I'm still not good at meditation. I've been doing it since I'm like 5 years old. But when you get more comfortable with it and you get more skilled at it, and over time that shows up. Look, meditation is a practice. It's not a thing, it's a practice, because we're practicing. We're constantly practicing to do better. And the goal of it is not to get off of the cushion and feel awesome and feel light and easy, but it's really to change how we interact with people and interact with our environment and interact with our thoughts in real life. So, I don't think there's anything like a good meditator or a bad meditator. It's really just about doing it.
Yeah. And to your point of, really changing how you approach life, I think that brings us to another concept, which I think is a lot easier for a lot of people to do and really does come into play in the holidays. And that is practicing gratitude. It doesn't take a whole lot of effort. It doesn't take, any particular skill aside from noticing things that you're really thankful for. Can you talk a little bit about gratitude and any studies or any evidence that we have and maybe there isn't, that it's really beneficial?
No, I love that you're bringing this up. I'm grateful that you're bringing up gratitude. Gratitude is incredibly important, and sometimes it feels really, really challenging. One of my favorite interventions is a gratitude journal. And what you do is every night you just write down 3 things you were grateful for. And, you don't want to repeat the same things day to day. And you don't want to talk about the grand things like I'm grateful for my kids or I'm grateful for my job. You want to talk about the little things like I'm grateful for the way my meal tasted today. I'm grateful that I took that walk today. And there is really, really good data on doing gratitude journals. I'm an immunologist, and there's actually studies looking at the immune system and the benefit to the immune system by doing just these very basic gratitude journals. So yes, it makes us feel better. It makes us feel present, but there does seem to be some physiologic benefit as well.
Yeah. And I think that this is a season where all of us can really take a moment and look around and be grateful for everything that we have, both the big things and the small things. And then the last piece that you had mentioned was sleep. And I find that sleep is one of those things that can be really challenging in general, but especially during the holidays where your brain is racing with the 9 million things that you have to do. Oftentimes people's, circadian rhythms are thrown out of whack, either because of travel or because of a very hectic schedule. And for people who are going through a cancer journey, that can be even more difficult. So can you talk a little bit about the benefit of sleep and how people might approach sleep if they're having difficulty getting a decent amount of sleep every night?
Sure. I mean, there's lots of different reasons why sleep becomes a problem, and I can't tell you how underdiagnosed things like sleep apnea are, but also, I said I'm an immunologist, I'm also an allergist, allergic rhinitis. I'll put people on something as simple as a nasal spray, and all of a sudden their sleep improves, their well-being improves, and that's the beauty of integrative medicine, right? Is I'm using conventional care, but I'm using it to improve well-being. So once you've ruled out those sorts of things, yes, there's a group of people where the voices just start showing up because things get quiet and we start having these conversations with ourselves, and we can be our own worst enemies in those conversations. So practices during the day like meditation can be really helpful at quieting those voices, but sometimes that's not so easy. I've fallen in love with there's an app called Sleep Stories on the Calm app, or Spotify has its own version of this. And these are just really, really boring stories that you can listen to that knock you out. And the first time I tried it, I actually passed out for an afternoon without even realizing it. So they're just distracting, but they help us sleep. But yes, sleep is incredibly important to our well-being.
Dr. Gary Soffer is an assistant professor of clinical pediatrics at the Yale School of Medicine. If you have questions, the address is canceranswers@yale.edu, and past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next week to learn more about the fight against cancer here on Connecticut Public Radio. Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital.